Continuing with our digestive disorders, let's look at another accessory organ, the liver. Let's talk about hepatitis. Hepa, root word, always going to mean liver. Itis, inflammation. So hepatitis, literally inflammation of the liver. Now notice that this doesn't tell you why. There are lots of possibilities here. Can be caused by drugs and toxins, can be caused by infections. Most cases are viral, all right, the hepatitis virus, and there are a few of them. But again, hepatitis, you don't know why. It can be lots of causes. Hepatitis doesn't tell you what caused it, just tells you that the liver is inflamed, okay? Symptoms may include jaundice. Remember, liver is what's breaking down bilirubin, and so if any time the liver is unhappy, you may end up with too much bilirubin left in the blood, and then your skin and the whites of your eyes are going to turn yellow. Flu-like symptoms as well. Feel sick to your stomach and so on. But many cases are asymptomatic, and that's the problem. A lot of people who have hepatitis don't know it. So I don't think you can just ask questions, before you leave the nightclub with somebody new. They could have hepatitis even if they're not feeling it. Hepatitis A, the oral fecal route. In other words, this is food contamination, improperly prepared food. And if you look at the lower illustration there, look at the countries in the world where hepatitis A is a problem. Yeah, basically everywhere, except the U.S., Canada, Western Europe, and Australia. And a lot of that has to do with sanitation stuff. I know in Central America, one of the problems there, a lot of hepatitis A, it's not necessarily because the people who are making your food are doing a bad job. They can be very careful. What it comes down to is a lot of like in Belize and Guatemala where I traveled, a lot of the cities and towns there don't have any sewage treatment facilities. They just basically, all the toilets just flow into the river. So the rivers are highly contaminated with human fecal matter and animal fecal matter as well. And what happens is in many cases they grow crops and they have to irrigate the crops. So what do you do to irrigate the crops? You just dig a little channel from the river to where your fields are. And you irrigate your crops with river water. Well, that river water is contaminated, and therefore you get contamination all over your crops. The kind of rule in Central America was if you can't cook it or peel it, don't eat it. A lot of the ways that people end up with hepatitis is from a salad because there's contamination on the vegetables themselves. And of course, you can't wash them because the water supply is generally contaminated. So washing it doesn't really wash away the contamination. Just may replace some contamination with different contamination. Hepatitis B, sexual contact, tattoos, needle sharing, breastfeeding, both acute and chronic. Hepatitis A is acute, short-term. Hepatitis B can be chronic as well. Mothers, who have it can pass it to the kids, unfortunately. Needle sharing, drug users, sexual contact. Tattoos, it's surprising. There's kind of this myth, basically, that, as long as you see your tattoo artist use a brand new needle, everything's going to be okay. Well, one of my students, her mom was actually an inspector for the health department, and what they found is that in some of the tattoo parlors, what happens is the virus can make its way back up into the tattoo machine. So even if you're changing needles, the virus may be resident in the machine itself. So you've got to clean the machines as well as just use new needles. So be careful about that when you get a tattoo. That is one of the ways people do get hepatitis. And hepatitis C, blood contact, and usually chronic, can lead to cirrhosis. Hepatitis C is a big deal. It is now apparently the most common blood-borne infection in the U.S., although, that can change from week to week. But it's common. A lot of the boomers, people my age, ended up with, blood contact back in the old days from drugs, from sex. And it can lie dormant for a long time. That you don't know you have it. You keep having sex with other people. You keep spreading it to other people. And it can be asymptomatic for decades. So you watch on TV now, there are lots of commercials for hepatitis C drugs. And they're mostly targeting baby boomers. Although, as you can see there, Pamela Anderson, even some of the... She's not actually a baby boomer. She's kind of old at this point, I guess. But, watch out. Yeah. Be careful with sex and be careful with sharing needles, okay? So cirrhosis, Cirrhosis is basically what happens is your liver, under constant stress from all kinds of things, liver cells start to die, get damaged, and you start replacing functional hepatocytes with dysfunctional tissue. So healthy liver tissue by scar tissue, and you get these regenerative nodules. So what happens is, as your liver goes bad, your liver keeps trying to regrow, but the regrowth is like scar tissue, and it doesn't do any good because it's not functional liver tissue. So cirrhosis is kind of one of those, positive feedback sorts of things here. Damage cannot be reversed. So as you get cirrhosis and you keep doing the things that cause you to get it, the damage is just going to get worse and worse and worse and worse. And so you get progressive loss of liver function. Symptoms, a variety of things that are going to be the liver. So jaundice, of course, if it's not breaking down bilirubin, yellow skin, yellow whites of the eyes. Ascites, remember? Ascites was one of those osmotic pressure problems here. The liver is making most of your plasma proteins. If you have a defective liver, it's not making enough plasma proteins. Therefore, the osmotic pressure in the blood is lower than it should be. The osmotic pressure in the interstitial fluid is higher. Therefore, water leaves the blood, goes into the interstitial fluid. And that's those guys that you see sometimes with the huge, monstrous beer bellies. What you're seeing is basically their liver. Because what happens is when the liver starts failing, what it does is it keeps trying to regrow, thinking that maybe it can grow new tissue and that'll make it better. It's a homeostatic mechanism that makes sense, but after a certain point, when your liver is too damaged, it can't regrow new healthy tissue. But the liver still continues that strategy, so it just keeps growing larger and larger and larger and larger. If we were in the classroom, it's too bad. I could bring in, we've got a liver from someone who died from cirrhosis, and it's the size of a basketball. I'm not kidding you. It's basketball sized, and that's what happens. The liver basically just keeps trying to recover, but it can't. And therefore, you're also going to get impaired immune system function because, remember, the liver is making a lot of those, and blood clotting, all those plasma proteins, all right? So liver disease, oh my God, this is not something you want to get. Liver disease is not a happy diagnosis. And remember, it generally can't be reversed. Alcoholism, hepatitis, 2 most common causes, all right? Hepatitis B, most common cause worldwide, okay? So be careful with your liver. Liver trouble is not a happy diagnosis. Take care of your liver, kids. Like the guy in the lower right. If you want to have cirrhosis, there's a good strategy. Just do that on a regular basis, and you can end up dying a very unhappy death. Appendicitis, so remember the vermiform appendix hangs off of the cecum. It's part of the digestive system. It's really kind of a lymphatic organ as well, because it's got a lot of macrophages, lymphocytes there. The appendix in humans is kind of not really very functional, but in some other animals, the cecum is huge, and the appendix, vermiform appendix, can be huge. So it really is effective in terms of immune function. Not so much in humans. So appendicitis, again, itis, inflammation of the appendix. This is a medical emergency because if it ruptures, what's going to happen is it's full of bacteria. There you see in the lower left, that's an infected vermiform appendix. That's just full of bacteria. So remember the peritoneum. This is why I keep talking about the peritoneum all the time. A ruptured appendix, therefore those bacteria can now spread through the peritoneum, and they now have access to all of your other abdominal organs. So those bacteria now are getting into where your liver and your pancreas and your stomach, and of course there are lots of major blood vessels down there, so now you can get bacteria into the blood as well. And you can end up with peritonitis, so inflammation of the peritoneal cavity, leading to septicemia. Septicemia, basically infection getting into your blood and then your immune system responding. And you can go into shock, massive vasodilation, lowering blood pressure. So appendicitis is a medical emergency because if it bursts, yeah, you can die. People do die from burst appendix. There's a great story a few years back. A guy at the South Pole got appendicitis, and it was like during the winter. And so they couldn't send the South Pole is inaccessible during the winter down there. You can't get planes in or out. I mean, they're constantly having blizzards with 100-mile-an-hour winds and stuff. And they had to do just down there. I can't remember. I should have looked up the story. I think it was a doctor who got appendicitis, and he had to remove his own appendix. Somebody I remember had to remove their own appendix. I don't know if it was a doctor or not. But basically, they just did a video call, and they kind of guided the person through it. But they had to remove their own appendix down there. So sometimes I know it happens that if people are going to go to a place where they know they're going to be there for like months, and they're not going to have any ability to rescue them or anything, sometimes they preemptively remove the appendix just so things like that can't happen. I've heard of that. I'm sure I have. So look it up. Usually caused by obstruction of the lumen of the appendix. So remember, the lumen is the opening where it's going to merge into the cecum. So if that gets clogged, then bacteria basically get trapped in the appendix, and then the bacteria start multiplying and dividing, and then you get a massive infection. Symptoms include pain in the umbilical region, nausea, fever, tenderness in the right iliac region. Makes sense. Remember, that's where the cecum is down there, the ascending colon. Positive diagnosis by a CT scan. That's the easy way. Usually in the emergency room, just a quick CT scan can confirm whether it's appendicitis or not. Differential diagnosis. Treated by a surgical remover, often laparoscopic, the laparoscope, so they can just make a little tiny incision and take it out and you're good to go. I had my appendix out back when I was 13, and back then you were in the hospital for a couple days because I still have my scar. They basically had to do surgery the old-fashioned way. They didn't have the laparoscope, so now it's a much better deal. Prognosis good, as long as you get there in time. It's an easy deal. My appendix operation was no big deal at all. Diarrhea. Upper right, notice any person with symptoms of diarrhea is prohibited from swimming at this time. Seriously, do you have to put up a sign for that? Yeah, knowing humans, you probably do. Oh my God. Welcome to the public pool. Guess what's in the water? Most commonly caused by gastroenteritis from bacteria, viral infections, or parasites. Gastroenteritis, inflammation of the stomach and the intestines. All right. Usually, it's contaminated food is the common way. All right. So you get contaminated food in there, and you start absorbing. You start digesting it, absorbing the toxins. And, your hypothalamus sees those toxins and goes, oh my God, what the hell is this? Sends a signal down to the stomach and the small intestine saying, get that shit out of here now. And so what you have then is the ingested material has to get moved very rapidly through the intestines. There's not enough time to reabsorb the water, all right? And your colon can't handle the reabsorption. It's not in your small intestine long enough. And so that's what you get. You just get very watery feces. That's what diarrhea is. Just a bunch of water with all the fecal material. Not usually associated with the flu. A lot of people mix that up. They say, the flu, oh yeah, you get diarrhea. Not usually. And vomiting, not usually with the flu either. Remember, influenza is a respiratory virus. Flu symptoms are usually coughing, sneezing, sore throat, things like that. People mistake it. Sometimes you hear people say stomach flu. There's no such thing. There's no such thing as the stomach flu, right? That's actually a gastrointestinal virus, okay? And yes, GI viruses can cause lots of diarrhea and vomiting, and you can get those. They happen, all right? So along with contaminated food. Major cause of infant death worldwide. Think about that for a moment. Here's a good critical thinking exercise. Why? You think of diarrhea as being unpleasant, but lethal? What the hell? Think about it. What's the major cause here of diarrhea? Contaminated food or viruses. So what does that mean generally? Well, in a lot of third world countries, the problem is the water supply is contaminated. So you've got an infant getting contaminated water, contaminated food, and that's going to cause diarrhea. What's going to happen if you have diarrhea over a long period of time? Well, you're going to be losing lots of water. That's going to lead to dehydration, right? How do you fix dehydration? By drinking water. What's the problem? The water is contaminated. See, it's a positive feedback loop. And so what happens is infants, and infants are especially susceptible to this because of their small size and low body weight. So what's going to happen here is you've got a positive feedback loop. The worse the diarrhea gets, the more water you drink, and then that makes the diarrhea even worse. And eventually infants die of severe dehydration. They can't be hydrated. So it's more serious than you think. We are so lucky in this country. The fact that you can turn on the tap and the water that comes out of it is actually drinkable, you don't realize how lucky we are. Many, many places in the world, people have to go to the nearest river or lake or whatever to get their water. And in many times, like I was mentioning, was the case in Central America, that water is contaminated. People are drinking contaminated water. There's no clean water everywhere, anywhere. So it's a big deal. It's too bad. It would be great if we could have like some sort of project where we would try to give everybody in the world clean water. That would be such an incredible benefit to the entire planet. Loss of fluids, electrolytes leads to dehydration, electrolyte imbalances, end up with hyponatremia, hypokalemia, all that kind of stuff. Further ingestion, positive feedback loop, and infants die. Major cause of death worldwide for infants. Symptom of many diseases and disorders, diarrhea, basically anytime anything upsets your GI tract, you're going to get diarrhea. And what do you do to treat? Well, you got to treat the underlying cause. What's the source of the problem? If it's contaminated water, you need good water. If it's a contaminated food, you need good food, whatever. So in severe cases, they may hospitalize people in order to give them IV fluids. Okay, so diarrhea, potentially dangerous, not just inconvenient and uncomfortable. So diverticulosis and diverticulitis. So cool stuff here. Diverticula are small pouches in the lining of the colon that bulge outward. So look in the upper illustration there. See those little bubbly, bumpy things, all right? Those are diverticula. And what causes them? Sometimes mysterious. There are a lot of still hypotheses. Apparently sometimes I find people who, bite their fingernails, you have like fingernail clippings in them, popcorn seeds, weird things that basically for whatever reason are indigestible, that make it through your small intestine into the large intestine, and then they basically get stuck in the lining of the colon. And then they basically get trapped in there, and they make these little diverticula. Most common in the sigmoid colon, down there at the end of the colon. The sigmoid colon, remember, is where it makes the S, and that's where things are going to kind of slow down. Other parts of the colon, things are moving pretty rapidly. When things have to make that big S down there, they slow down, and apparently that's when the stuff can get trapped. Diverticulosis is the condition of having diverticula, and then, of course, if you have diverticulosis, that can lead to inflammation of the colon, and then you get diverticulitis, right? So see how those all work together? Diverticula are the little bumpies. Diverticulosis means you have diverticula, and that often will lead to inflammation, and now you have diverticulitis. About half of all people over the age of 60 have diverticula. Just over time, things just get trapped in there. I mean, over a lifetime of eating weird things, you get stuff trapped in there. So it's not uncommon. Lots of people have them. It's just when it becomes a problem, all right? It's often asymptomatic, can cause abdominal pain, associated with diets low in fiber, high in processed foods. So diverticulitis is actually not very common in Africa and Asia. A lot of those people may be very poor, but at least they have good diets. We here in this country often don't have very good diets, and we eat the stuff that leads to the problems. It can lead to fecal lith stone. In other words, it leads to basically little poop stones. And those can get lodged in there and cause abscesses and perforations, possibly resulting in peritonitis. So you get an inflammation there of the peritoneum, of the serous membranes lining the abdominal cavity. And that's because, again, if you get fecal material trapped in there, along with, the fingernail clippings or the popcorn seed by itself, not probably a big deal. But if feces gets trapped in it with it, then the bacteria start growing. The bacteria form abscesses, perforations, possibly peritonitis. And they can also lead then to fistulas. So a fistula is an abnormal passageway between two organs. Most common between the colon and the bladder, can also happen between colon and vagina. So you see in that middle illustration there, you've got, you had diverticula there in the colon. And so what they did is they are then leading into a colovesical fistula, all right, from the sigmoid colon, leading down into either the urinary bladder or into the uterus potentially. So you get bacteria basically eating their way. They basically eat a passageway down there. And so then you end up with, bladder infections, possibly uterine infections. This is not a happy thing to have, I wouldn't think. I don't have a uterus, but if I did, I don't think I would want fecal material in my uterus or in my vagina. That doesn't sound like fun. So potentially a problem here. But again, most people will end up with diverticula, just the way it goes. Now then, something that I want to make sure you differentiate this from the next thing. Here is irritable bowel syndrome, IBS. Notice syndrome. What does the word syndrome get used for a lot in medicine? Syndrome basically means just kind of a cluster of signs and symptoms that often don't have a definitive cause. All right? It's just basically a cluster of things that you kind of go, yeah, we see this a lot, but we're often not really sure why. So don't mix this up with inflammatory bowel disease, which we're going to talk about next, IBD. So the first two letters are the same, IB, but notice they're very, very different. In inflammatory bowel disease, I is for inflammatory. In irritable bowel syndrome, I is for irritable. Okay, these are hugely different, so don't mix them up. IBS is a syndrome, no organic cause known, cannot be conclusively diagnosed. Lots of hypotheses, they keep finding out more and more. It happens to a lot of people, so it's a real thing. It's just they're not sure exactly what's going on. Maybe, a brain-gut connection. I don't know, lots of possibilities here. Once thought to be psychological, now really, maybe a CNS, ENS communication problem. So it's a real thing. Let's be clear on that. It's a real thing. It's just not exactly clear what the cause is, okay? Constipation, diarrhea, abdominal pain. Does not involve inflammation or bleeding. Not associated with higher risk of colorectal cancer. That's the important point right there. Because IBD, inflammatory bowel disease, is associated with increased risk of colorectal cancer. IBS is not. It's just basically an uncomfortable situation. No definitive treatment. Change your diet. Manage your stress. Maybe some medications, all right. April is IBS Awareness Month. How to cure your IBS. You can find lots of cures online. This is where there are lots of scam artists out there. Be careful. Again, it's a real thing, but the problem is because there's no definitive cause, all kinds of people propose treatments for it, and a lot of them really are just garbage. There are various groups, support groups and stuff like that. If you have IBS, you know somebody with IBS, talk to your doctor and talk to some support groups. There can be lots of helpful information, but don't just click on buttons on the internet. And don't believe every book you see in the self-help section of the bookstore. You're going to get a lot of garbage advice, okay? And also notice, don't confuse this with irritable bowel syndrome, okay? That would be a whole different kind of thing. And there's irritable bowel syndrome, all right? Yeah, so don't confuse it with that either. All right, so here we go. Now, in contrast to IBS, IBD, inflammatory bowel disease. That's a broad umbrella term used to refer to ulcerative colitis or Crohn's disease. So I is for inflammatory, not irritable, all right? Symptoms of both include vomiting, diarrhea, abdominal pain, bloody stools, all right? There is a sign that something is not happy. Both do carry an increased risk of colorectal cancer. So this is something you definitely need to get treated. You definitely need to go to the doctor for this, and they need to put you on a controlled management program to deal with this, okay? A number of my former students have had this, and they were willing to talk about it in class, and it was great. We were able to find out lots of things. So there are a lot of people who have this. Probably some of you do. So just, it's something you just need to get taken care of, all right? A lot of people have it. So ulcerative colitis affects the mucosa of the colon and rectum, so we're going to affect the lining then. Remember, you're secreting mucus all throughout your colon and rectum. Presumed to have a genetic basis, okay? Treated with anti-inflammatories as well as some immunosuppressive drugs, as well as surgery in some cases, okay? So there you go. There is ulcerative colitis. Then Crohn's disease, similar. It affects any part of the GI tract, okay? Thought to be an autoimmune disorder. So, again, autoimmune disorders are hard to pin down, not sure which ones are and which ones are, but this one they think probably is. And you need some immunosuppressive drugs and some lifestyle changes as well. So, if you've got either one of these, make sure doctors are what you need to do. And they're manageable, all right? But you got to take care of them because they do increase the risk of ultimately colorectal cancer, which is not something you want to have. And speaking of which, colorectal cancer, cancer of the colon and the rectum, all right, associated with age, most people who have it over 60. Family history runs in families. Diets high in red meat and low in fiber. Again, look at our lifestyle. Has so much to do with the problems we create for ourselves. Smoking, so many carcinogens and cigarettes, and so heavy alcohol use, and IBD. So look at all these digestive things, add up over time. A good diet really does make sense. Eating, vegetables and fruits and things like that, and staying away from processed foods, that's not just some kind of new age snowflake thing. That's actually common sense. Makes a lot of sense. Thought to arise from adenomatous polyps. So the polyps themselves are not cancerous. That's why you're supposed to get a colonoscopy once you turn like 50. All right? But they can lead to cancer over time. So there you see in the lower illustration, those are the polyps. So, for me, the thought of getting a colonoscopy was so unpleasant that, at 50 I did not get one. I waited 10 years, finally got one when I turned 60. And I was fortunate. They found no polyps at all. The gastroenterologist said, "Damn, you have a good-looking colon." I said, "I'm sorry, I'm not dating you." Often metastasizes the liver. So there's the problem with colorectal cancer. Again, lots of cancers, if they stayed in place, they wouldn't be as big of a deal. You could go in and get, part of your colon removed, right? That would solve that. But the problem is, remember, all the blood from the intestines goes through the hepatic portal vein to the liver. See, so here you have basically a connection. All that blood. So if you start with cancer somewhere down in the intestines, that blood, cancer is going to get into that blood. It's going to be carried to the liver, and the liver often comes next. That's why you often see liver cancer as a metastatic consequence of any kind of intestinal cancer. Symptoms include change in bowel habits, bloody stools, black tarry stools, reduction in stool. A clue is sometimes you don't necessarily see blood, but the stool will become, instead of just kind of a chocolatey brown, it becomes black and kind of tarry, kind of like black and sticky. That often is an indication that something's gone wrong. So talk to your doctor if you see something like that, okay? And chemotherapy, surgery. If they catch it early, like most cancers, pretty good diagnosis, but once it metastasizes to the liver, you're out of luck. So always, check the toilet before you flush, okay? Makes good sense, actually.